we are going live today to talk about a brand new hot off the press article from the one and only Jon Stone. And we're going to talk about why conversion order is out, FND is in, and all the harms that conversion disorder, boy, I just mess up saying that, the harms that conversion disorder and that diagnosis have done to people. So we're going to dive right in. My name is Julie Hirschberg. I am a neurologic physical therapist. I'm on Team Neuro here. I'm at re+active Therapy and Wellness. I'm not just there. I founded re+active Therapy and Wellness. We're in the Los Angeles area, and we work with people with functional neurologic disorders. We do teachings and trainings with clinicians all over the world as well. So this is a very passionate area for me. And this article just came out. So let me share the title with you. It's not a research article. It's really a review and opinion piece. A perspective piece. It's called The Legacy of Psychoanalysis for Functional Neurologic Disorder, Insights and Harms. And it is, I'm probably his biggest fangirl, but Jon Stone, who is a neurologist based in the UK, and really one of the modern day warriors, advocates, researchers in functional neurologic disorders. And I will say this entire journal for the month that came out, published online on May 5th, has loads on functional neurologic disorders. So I have many more articles to read and to dive into, but I had to start with this one because I still hear from patients, from fellow clinicians, a lot of talk about conversion disorder. And first, I want to preface this by, I went to school, I started PT school in 1999. So 23 years ago, I graduated with my doctorate in physical therapy, and conversion disorder is what I was taught. Conversion disorder is the term that was used for many of my patients. I've worked in many settings, and I saw that term again and again, and that is exactly what I was taught and how I understood some of these disorders. And a lot has changed in 23 years. So much has changed. And I also want to preface, by the way, I am not anti-psychoanalysis. And in fact, I will tell you as a student, as a person who goes to psychotherapy regularly, my first intro to that, and even I have two different therapists. One of them, that is his background from the Institute of Contemporary Psychoanalysis. Now, I think contemporary psychoanalysis is very different than maybe some of the things that we're looking at when we talk about Freud. So I just want to preface that. I'm not anti-psychoanalysis. I think there's so much that we have to learn from this. And in fact, Jon Stone in this article actually talks about some of the benefits of psychoanalysis and the harm that has come from calling a disorder conversion disorder. So be prepared. I am going to quote many parts of this article because I think they are so good. One of my favorite things about Jon Stone is the things that I read just, first, they're very well written, very articulate, very researched, a lot of background, and they just really resonate. So, Jon Stone, as you know, I might be your biggest fan. Or president of the fan club. I know a lot of us are big fans. So, Jon Stone is writing this article, by the way, in response to another article in this, the issue of neuropsychoanalysis, written by Mark Solms. And I haven't gotten all the way through that article. So it's pretty dense, and sometimes I just don't have good attention for a super dense article. So that is coming. But Mark Solms describes the contribution of Freud and psychoanalysis to the way we think about FND, and particularly talks about the predictive processing component. And I thought this was really interesting because we've been talking about predictive processing this week in our FND membership, which is our membership for people with FND. Chelsea yesterday did a fabulous reel explaining predictive processing, which was so very helpful. And there are some pieces of overlap with that in psychoanalysis. But what I love is that those are the things that Jon Stone says. He has a big but, and he says, and the reader can probably feel a but coming. Like, I knew that was coming. And he says, there are problems here, and some things have been glossed over in the story. And so I think this is really important to talk about. And I actually highlighted and shared this particular quote. So I'm just going to put it in here and read it to you. This is where he says, like, one of the biggest harms has come. So crucially, there are people with FND symptoms who have not had trauma and have come to develop paralysis or seizures or tremors or any other things, right, via alternative pathways, such as a physical injury or an infection, right? Infectious illness. Trauma and stress appear to explain FND about as well as smoking explains stroke. They are relevant, but doesn't explain the whole picture. Over and over in FND epidemiological research, the facts tend to spoil beautiful unifying theories. That says so much right there. And so trauma, stress, important to consider. They just aren't the whole picture. And that's the biggest criticism to really understanding FND as very different from conversion disorder. So I want to go through kind of point by point in this paper. And one of the things that has been noted in FND is that in the past it was thought and understood that childhood maltreatment, stressful life events might be closely tied to FND symptoms. However, in looking at the evidence and looking at if these are strong risk factors, when they pool all of these things together, this is really only incrementally more than other disorders like depression or even migraine. So part of that is showing with evidence that dispelling this myth, really, that trauma or stressful life events must be the cause of FND. So there's some evidence there. Now, let's talk about some of the insights of psychoanalysis, because as I mentioned at the beginning of this, I'm not anti-psychoanalysis. There's actually some really lovely pieces in understanding psychoanalysis. And one of the things that he shared at the beginning of this is about listening to patients. And I will say the majority of what I've learned about FND is from listening to patients. And he highlights one of the articles that I truly, truly love and maybe have learned more from, which is called, it's an online essay that is written by the incredible FND portal. It's called Cadenza for a Fractured Consciousness. This is a person with FND writing about it, and it's beautiful. It's very, very well done. And this is something that Jon Stone writes has been such an important contribution of psychoanalysis, is this listening to patients. And what we understand from those like early times of Freud is is the time that people took to really listen to patients' stories. And I think the history here is interesting and it's important because many people are like, well, what did this term conversion even mean? And what historically this was meant, that they meant by this is that people may have a conversion or even a diversion of an abnormal attentional focus away from feelings that are hard to confront or access in favor of having a bodily dysfunction. And so this would be an understanding that FND symptoms could develop as a mechanism to avoid or rather than experience unbearable body sensations. Now, there are some things that could be true for this, right? So this is where it's not black and white, right? But this is not everybody's experience. It is true that some people may develop very protective experiences after a physical injury or pain, right? So they may actually develop a sensory loss. The brain might develop that in protection of pain, right? That is very adaptive and understandable. As Jon Stone writes, it's very adaptive and actually should happen in the short term. Not helpful for a lot of people in the long term because we need to feel our bodies to move well, but adaptive in the short term. That is not a conversion disorder. That is actually a pretty helpful adaptive mechanism of the brain. And so distinguishing a disorder from actually adaptive and protective is very different things. That's also not everybody's experience. So I think, one of the other big points that Jon Stone makes in here is that this is very simplistic. Conversion disorder is very simplistic. It really is looking at this is just a problem of the mind, not of brain networks and circuitry, but purely of the mind. So, and I'm getting ahead of myself. I'm getting way ahead of myself. So another part of this article that he talks about that I found very, very interesting. As you see, I like to read. This is just a few of my books. I have a whole other bookcases behind this door. I really, really love to read. And psychology was actually not my major in college, but that I had a sociology part of my degree and took a ton of psychology courses and found a lot of the people in psychology very interesting, right? But what I didn't learn is some of this particular history that Jon Stone outlined, that there was a lot before Freud's time that actually captured functional neurologic disorder. Now, in the 1800s, they were calling it hysteria, or as oh my gosh, as Charcot called it, a dynamic lesion. That might be one of my favorite from the 1800s. It was a dynamic lesion. It was something in the function or connectivity that changed. These people other than Freud were describing things like functional paralysis and functional changes in the brain causing these things that we now recognize as functional neurologic disorder before the term conversion disorder ever came to be. And in fact, they were calling it a functional connectivity issue. Often, and I think it was, let me go down in here. There were several people. It was Russell Reynolds found that it was often triggered by an injury. And this we see a lot in folks. Any kind of injury, by the way, whether that's a musculoskeletal injury, an inflammation event, any of those things could potentially trigger functional neurologic disorders. And this was described in the 1800s. So not new at all. It was really, what I found interesting in this history was that it was Freud and this idea of conversion disorder that really kind of overly simplified all of this. These other folks like Reynolds recognized that not everybody had a psychological injury component of this, and that it looked multifactorial. Sometimes it was coming alongside a neurologic disorder. And actually there was a really interesting part that I didn't know. I think the name is Coombe, Coombe, Coombe. He's credited with first using the term functional in 1838, concerning nervous system conditions where the function has gone awry. And it was Thomas Laycock in 1860 described this functionalist view of the mind and brain. So anyway, we actually had these terms looking at multifactorial contributions to symptoms long before conversion disorder kind of replaced them. It replaced something, and as Jon Stone, it replaced these existing multifactorial models with one that was less messy and more appealing, because it was simple. And honestly, I get this, right? We're kind of simple people, or we're not simple people, we're really complex, but we like simple explanations. Like, give me an explanation of I did this. I think about this with ACL injuries. I did this mechanism and therefore this occurred, right? If this, then this. And that is essentially what conversion disorder did. It replaced there's a lot of complexities in the brain and body that could lead to these symptoms with, let's call it psychological, purely psychological. And that's it, because there are cases where there is trauma and there are psychological causes of functional neurologic disorder. So, I found that so fascinating. I did not know that particular history. It blows my mind. I think it's so fascinating because it blows my mind because what was thought to be super helpful was so harmful. So I want to talk about the three major themes that Jon Stone talks about in the harms of this, from going to something that was really this is multifactorial to let's actually make it simple, but what's the harm of that? So the number one thing he talked about is the promotion of dualism. So psychoanalysis, not maybe purposefully, but it really reinforced this dualistic approach to people with FND. Dualism meaning Mind over here, brain over here, two separate things, not interacting. And one of the things Freud actually said, he considered functional paralysis, and I'm quoting from Jon Stone's paper here, to be independent of the anatomy of the nervous system. And this also blows my mind, because how can that even be? How can paralysis be independent of the brain where movement is created, right? It makes no sense to me, but I'm sure it made a whole lot of sense in those times. But the idea of conversion disorder really separates mind and body. And the invention of conversion disorder really put it firmly in, this is a purely psychiatric problem. There's no neurology here. That still blows my mind, because movement, strength, like thought, all of those things are neurology, right? That's how we understand them now. But this was, even though there are many known other disorders where they're the function of the brain, right? So migraine, epilepsy, those still hung out in the neurology world. No one was calling those psychiatric, and they're not, and neither is FND, right? So this was a really, as someone said here, living between signals, FND, living between signals. Oh, that's lovely, FND. This person says, it blows my mind that Freud and conversion disorder has taken us entirely too far backwards. Yes, that blows my mind. It blows my mind that actually the people before him actually were like not in this dualistic world. They were actually like, there's many things that are intermingled here in the brain and mind and body, and it is really false to be separating them. And then he kind of like took us backwards, way backwards, right? And caused a lot of harm. Dualism is one of those harms. And I think this is so interesting, because we still hear this, but as Jon Stone said, when I was training in the 1990s, many neurologists coped with their ignorance on the causes and treatment of FND by either disowning the problem, this still happens today, like, good news, you don't have a neurologic condition, and assuming it would go away if we just ignored it. Like, this should all clear up in a few weeks. I can't tell you, and like, you can tell me in the comments if you're a person with FND or a clinician, if you've heard that before, because I have heard it way too many times. Like, this will just go away. It's not my issue. Let me send you to psychiatry, which is so very unhelpful for a disorder that is not entirely psychological. People kind of were assumed to have nothing wrong at all. And so the dualism, super unhelpful. Thank you. No, thank you, Freud, for your dualism. So let's go from there. So dualism was number one. Number two, overly simplistic monocausal view. And so this one I already started to hint at. I just want to, this beautiful brain said, oh my goodness, my doctor, this is what they said. My doctor said, just go on a vacation and you'll feel better. 2024, not 1861, 2024, and neurologists are still saying this from a very clearly not understanding functional neurologic disorder as a neurologic disorder. Neurologic disorders don't get cured by going on vacation. Now, I will say, we all tend to feel better on vacation. People after a stroke, people with MS, some of their symptoms get better. A person with FND might also feel better on vacation. It doesn't mean that not being on vacation caused your FND. It just means that, like, maybe your you're feeling better on vacation. That's true for every neurologic disorder. It's not a treatment. But I can't tell you how many patients are like, will come back from vacation, like they have peripheral neuropathies, they have muscular disorders. They're like, I feel so great on vacation. And I'm like, great, like, let's keep you going on vacation. Like, what can we do to keep you enjoying those things in your life? But gosh, this beautiful brain says this, and I also am just so sorry that's happening in 2024. Dot Berry says, I definitely relate. Heard from both psychiatry and neurology. It's purely psychiatric. They treat me as if I'm so psychologically damaged. This is harmful. This is the harm of the term conversion disorder, because it's just so much more complex than that. It's not to say that our psychology or our emotional world or how we think and learn and do things is not important. It is very important. It's just not the only thing, because these things interact. And living between signals, FND also said, FND is all, oh, my neuro this week said, well, you know, FND is all psychological. Not sure what we're supposed to do to help. Fired her immediately. Well, I'm so glad. And I really hope more neurologists are reading some of these things, like this paper from Jon Stone, to just learn better and do better. Clearly, that neurologist it doesn't have a contemporary understanding of FND because it's not all psychological. And also I will say this. I do understand neurologists not really knowing what to do. They don't have a lot of tools in their tool belt for FND. They do have diagnostic tools to give a positive diagnosis. They do have treatment tools to give the appropriate referrals, not just to psychology, but there's not a lot of medications that they're looking to give. And we wrote, by the way, our team at Reactive, Ava Sisio as first author, wrote an article for neurologists to have more tools in their tool belt when they're working with somebody with FND. We wrote that because we were working alongside neurologists who were like, we need more things. There's not a lot we can do here outside of the diagnosis and referrals. So we wrote a paper. It's in Practical Neurology. It's super helpful. Okay. Thank you for those great comments. Let's go to harm number 2, this overly simplistic monocausal view, which you are so well articulating, living between signals, FND. You saying this because your neurologist has this overly simplistic monocausal view, meaning it's just psychological. That's overly simplistic. And the issue, I love how he talks about this, the issue of conversion in the name of it's actually giving the cause there, right? So anxiety, he makes this really great point. Things like anxiety or depression, they're not, the titles of those as a diagnosis, they're not giving the cause. Conversion is actually saying this is caused by your trauma, right? And so it's giving the cause, the etiology in the name. And this is really problematic and way too simplistic. This is where then Jon Stone talks about some of the pieces like predictive processing models. And if you're not aware of this, go watch our last reel that Chelsea made on predictive processing. It was fantastic, and it talked about this as a really helpful way of understanding FND, but also understanding a lot of the human experiences, including things like phantom limb, even migraine. My favorite example of a predictive processing is that I wear an Apple Watch. And it buzzes every now and then to tell me to stand up. And sometimes when I'm not wearing it, I get buzzing on my wrist. And I actually think it's kind of the coolest thing ever because I go, oh my gosh, that's so funny. Like my brain is predicting a buzz and I don't even have this on my wrist. best example that I have of my own predictive processing. I just want to read this comment by Dot Berries. I agree with the comment above. Love being in therapy and being in it years. I've done so much better. Just because they can't find anything physically wrong, they immediately turn to the mental. Yes. And isn't that overly simplistic, right? Isn't there more that we can look at? Our sensory systems, our autonomic nervous system, lifestyle, motor control, all of these pieces working together. That is the problem with conversion disorder. It's monocausal, overly simplistic. In talking about this overly simplistic monocausal view, it's harmful. Body symptoms are not always an expression of a psychological issue. Now, can we have body symptoms from psychological things? Yes, we can. Absolutely. Anybody who's started tremoring when they're super anxious, giving a talk, right? Like that's probably the most common that happens to me. If I'm going out to give a talk in front of a big audience, my hands are shaking like crazy. Yes, that is a body symptom from a psychological cause. Absolutely. It doesn't mean that every time I might experience a tremor is from a psychological cause. And it doesn't mean that every single thing that I experience in my body is from a psychological cause. It's both, right? So that's why we really have to think of multifactorial. We don't also want to ignore the psychological components. No, we shouldn't ignore them, but we shouldn't attribute every single thing to them either. I think that is really important. And I hear this all the time from people with FND that they're like, well, I was having headaches and they said it was the FND. And they're clearly having migraines that could be medically managed and they're refused medications for migraine because it was attributed to FND and conversion disorder. So therefore it's psychological. That is completely inappropriate and just not consistent with anything else that we do in neurology. If somebody has a stroke and also has high blood pressure, we treat both of those things, right? And we don't just attribute it all to the stroke. So that is the harm of conversion disorder. Number 3, and I think this is a really important one. Jon Stone writes, the danger of a theory with embedded reasons to disbelieve patient narratives. So I want to describe this in his words. He says, a common criticism of psychoanalysis is the way it places the patient in a double bind. If they deny a trauma, then they must have repressed it. The more the patient denies it, the more repressed it must be, explaining how severe the problem is. The readiness with which the psychoanalytic theory allows the observer to deny the patient's own experience is massively problematic. I've seen this problematic. I've talked to people with FND where they did go to psychology and it was like the person was digging and digging for trauma. You must have repressed trauma. You must have trauma in there. This is no way, by the way, to build a therapeutic relationship with somebody is to dig for trauma. That's not very helpful. And it just ignores all of the other experience for the person. And so I've heard very firsthand from patients how traumatic it was to be in a psychotherapeutic relationship where the person insisted they must have repressed trauma and insisted on trying to dig for that. And that caused more harm than help. And what Jon Stone writes is that people with FND often find themselves in a situation where the reality of their neurologic symptoms are also completely denied. He didn't write completely. I wrote that. Also denied by health professionals. I can't tell you how often this happens. They're told they're faking it, that it's not real, that they have control of it, that they could just like snap right out of it. Denying a person's experience, and then heaping on loads of shame to the person for causing their symptoms. This is really harmful and one of the harms of conversion disorder. So, three major harms: the promotion of dualism, the oversimplistic monocausal view, and then three, the danger of a theory with embedded reasons to disbelieve a patient. So if people have been really impacted negatively by a medical professional because they were said they had conversion disorder. First, to my fellow healthcare professionals, this is not unusual, and you shouldn't be surprised that a person might be harmed this way, and that person might not trust you because they've been told this over and over again, and they don't know you and your understanding. We have so much to do as healthcare professionals to keep spreading the word and breaking this myth. Conversion disorder is out. It's not even the diagnosis. Now, I have to say, in the ICD-10, those stupid diagnosis codes you have to use for insurance, it still says conversion disorder. The next iteration of this that's coming does not anymore, but it still says that. And that is harmful. I will not use that diagnosis code. There's loads of other things that we could use. We could use extrapyramidal movement disorders. We could use weakness. We can use many other things. We don't have to use that diagnosis code. I think it's harmful. Now, we can have a conversation about it, right? Perhaps I heard from one person actually that her insurance denied things unless it said conversion disorder. So if you're telling me your insurance requires that diagnosis code, fine, I'll use it. I hate it, but I'll use it. I will do things to help you get reimbursed by your insurance. It's so dumb, but I will do it. But it's harmful. This beautiful brain is also saying, me too, EMDR, tons of trauma work. I still have FND. Better, but not better. Yes. So that's the thing too. So what a beautiful point this beautiful brain shared is you can have a lot of trauma, physical trauma, emotional trauma, developmental, and have FND, and it might contribute to your symptoms, and there might be other things, right? So actually only addressing the psychiatric component could leave you hanging, right? Also, if you did have trauma and you only addressed physical and sensory pieces without the trauma, you might also be missing things there. It's multifactorial. We need to think of all of the pieces together. Living Between Signals FND says, I'm going to download this article and start carrying around with me to appointments. Just gently leave it on their desk, right? Out with conversion disorder, in with FND. Yes, I support that. I support that. And by the way, there's many articles that I really love with sharing with clinicians, medical providers, with contemporary updates. Because I will, some people just haven't been reading articles. I don't know. I was trying to give people a pass, but I was going to say they've got their nose to the grind. They're seeing patients. They're really trying to help them, and they're outside of the contemporary of what's going on. As a person that reads multiple articles every week, I just can't imagine a medical provider not being in touch with the latest things. But some people have a hard time shifting their perspective. I get it. This beautiful brain is living between signals FND is like, oops, fell out of my bag in the exam room. This beautiful brain is saying the biopsychosocial model. We have to think multifactorial. So I want to end with this. There is a reason conversion disorder is persisting in the world. It's simple. It fits on a PowerPoint slide. Trauma, FND with a big arrow in between. It's like 2 boxes, right? And if you've ever looked at any of my presentations or Jon Stone or any of the people that are teaching and talking about FND, it is not a 1 box, 1 arrow thing. It is like pew, 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 like all of these arrows all over the place. You've seen our pie chart probably. It is not simple, right? It is really complex. And one of the things, I'm going to read this whole section from Jon Stone at the very end because it loops into the predictive processing. He says, predictive processing, I mentioned this part actually, I probably got ahead of myself, are very powerful ways to explain many things, including FND, phantom limb pain, migraine. If they are correct, the predictive processing correct, then Freud was fundamentally wrong when he said that FND existed outside of neuroanatomy. Instead, FND is a disorder that ought to exist if one accepts that there is machinery, there is connections of predictive motor and sensory processing, which can become too strongly weighted or too precise. Oh, I love that. And then he even goes on to say even more. However, even if predictive processing models fulfill their potential, because this is kind of the leading hypothesis and understanding in FND, they are unlikely to offer the complete account of FND. I love that he says this because I'm on the predictive processing bandwagon. I love it. It's great, but it's also not enough. There's more than that. And Jon Stone says, multiple perspectives are needed to understand disorders like FND, ranging from computational neuroscience to brain networks, life narratives, and social perspectives. Crucially, these are not mutually exclusive. It's not one or the other. This messy, multifactorial, multi-perspective account is frustrating for those of us who like a simple model which fits in boxes on a PowerPoint slide. But it's also an account that allows space and curiosity for what we do not yet understand. I'm actually getting teary-eyed reading this. Jon Stone, this is so brilliant. I'm going to read it again. This messy, multifactorial, multi-perspective account is frustrating for those of us who like a simple model that fits in boxes on a PowerPoint slide. But it's an account that allows space and curiosity for what we do not yet understand. And this is the thing. Where conversion disorder came from, it came from a time and period where we did not understand a lot of this, and we could not understand. We didn't have imaging. We didn't have functional MRI. Now we do, and the science is showing us that it is messy and multifactorial. And you know what? I kind of like messy. I mean, look at my bookshelf. I'm not going to show you the rest of my room. It's a little bit messy. There's some organization to it, but it's a little bit messy. And so are our brains. They're not perfect, and they're a little messy, and the influence is multifactorial. I want to read this comment here. Top Barry says, feel this. I had to experiment with something to see if there was something physical that's perpetuating my flare-up. Ding, ding. I think it is. I'd require a diagnosis. Not ready to hear it's just FND. And here's the thing, as humans, we very rarely have one thing. Most people that I see with FND have other things, right? They have migraine. They have hypermobility disorders. They have dysautonomia. None of those things are FND, but they might coexist, and they also weren't treatment. And they're part of the multifactorial nature of FND. So I hope you loved this article as much as I did. I swear I'm going to read that like last paragraph over and over again because I love it so much. And I just love that we will continue to be curious, right? So right now we, the predictive brain helps explain FND, but it's not the only thing. I would guess there's going to be loads of other things that continue to come out, continue to be understood, and not just FND, by the way, many disorders. There was this brilliant article that came out this month on autism and Parkinson's disease. Like, there's so much that we're learning about many neurologic disorders that we don't understand. So to overly simplify and throw something into a purely psychological box because we don't understand it is so unfair and so harmful. So as a wrap up here, the article just came out in May. It's called The Legacy of Psychoanalysis for Functional Neurologic Disorder, Insights and Harms, written by Jon Stone. I will tell you, it is not free full text, but if you, as usual, you can go on ResearchGate. You can request a copy of this. I feel fairly certain Jon Stone would allow a copy of it for you. So go on ResearchGate, request a copy of it. And let's continue to be curious about things. Let's continue to ask questions. And as healthcare professionals, let's continue to really push back when people are calling something conversion disorder. I might actually send them this article, right? That's why I'm here, reading these things and sharing them here. By the way, I'll put the link to this and some of my other favorite articles, by the way, to share with physicians. I'll put a link to this in my newsletter. I send a newsletter to clinicians every Friday. You can sign up at reactiveeducation.com. I send a newsletter to patients every Monday. You can sign up at reactivept.com. And we now have on our website, by the way, if you go to reactivept.com, /FND, we put all of our resources in one place. Our free handouts, our free workshops, our article that I talked to you about that was written for neurologists so they can have more to do than just send people to psychologists. All of that, all in one place, reactivept.com /FND. Our FND program director, Chelsea Richardson, just put that together. Loads of free resources for you. Also, just some really great comments coming in here. Barry said, yes, and thank you for this. Needed it. This beautiful brain said, also psychogenic or pseudo seizures. Yep. Out with pseudo, out with psychogenic, in with functional. Much more a name that better embraces the reality of what is happening in our brain and body. It's not unicausal, monocausal, it's multicausal. Somebody else asked, where are you located at? I'm in the Los Angeles area. We're in California. If you are a person with functional neurologic disorder, by the way, somebody else had asked this. FND Hope has a great website where you can look for providers, because I know we're only in California, but also we have an amazing online membership for people with functional neurologic disorder. I actually posted this article in that membership to share with people, hey, look at what's new, look at what's out there. And this week in that membership, every single week, a member of our team is teaching on a topic. This week, we talked about the predictive brain. So it's really cool. It's a great place for people with FND to be around other people with FND and to learn from experts in the field. In fact, Jon Stone came to our membership. We have a wonderful thing that he recorded in there. So if you're interested in that, you can go check that out also at reactivept.com/FND. So thank you so very much for your interest, your curiosity, your love that our brains and bodies are these beautiful, curious things that don't fit in like these simple boxes. So I hope you can take that and remember that as you go into your clinical practice, as you go into your life. And thanks for sending great questions and comments. I appreciate all of them. And I'll see you next time. Have a good night.